Identify the organ. Larynx. Identify the organ. Trachea. Goes behind the heart. Goes behind that heart. Identify this organ. Identify, be specific. This is the right lung over here. Left lung in this organ. Heart. And what does this represent right here? Diaphragm. Very nice. When we look at the lungs, notice on here on the right side we have 1, 2, 3 lobes over here. And how about on the left side? 2. So upper, middle, or superior lobe, middle lobe, inferior lobe. Bless you. Now, these fissures that we see right here, luckily they're named logically. This one that goes across in a horizontal fashion is called the horizontal fissure. This one over here that's going at an angle is the oblique fissure. Very nice. And then this one over here, it would be called oblique fissure. It's going at an angle. So on top, we already know from our earlier study of our 4 major body membranes that this membrane that's transparent like saran wrap right on the lungs is called visceral pleura. The one that lines the wall of the thoracic cavity, parietal pleura. But this is visceral pleura right here. Then this surface of the lungs, it's going to touch the ribs. So what should we call this surface? The costal surface. Okay. This surface that we see right here is in this space. I'm sorry, let me take off the lungs and see if I can pull that up. Right here. See this space right here? This is in that space between the 2 lungs. What is that space between the 2 lungs called? It starts with an M. Mediastinal. Mediastinum. So what should we call that surface? The mediastinal surface. The mediastinal surface. That would be on page, for those of you following along. Oh, you guys don't have to know that, huh? Okay. Sorry. Guess you don't have to know that. And so then for 2 other terms that you do need to know on there looking at your list, this surface up here, see how it points at the top? That would be the apex, whereas this bottom flatter that's touching over here, the diaphragm, that would be the base on there. And then if we take this off, these 2 lobes right here, and we take the heart out, can everybody see this area right here where the bronchi are going in and we have pulmonary veins and pulmonary arteries? Excellent. Whoever, remember, they're the only 2 opposite in color, all the arteries and veins. This space right here where it's all entering or exit the lungs is called the hilum. The hilum. We're going to see that same thing in the kidneys. Frequently, whenever we have a space where something's entering or exiting, that space is called the hilum. Okay. What would this be right here? This point right here. Carina. And then what would this be right here? Primary. Right or left? Look at the angle of it. What's this one? Right or left? Right. Look at how straight up and down it goes. Okay. So this is why it's easier to lodge things over here on the right side. Over here, what would I call these branches right here? Secondary. And then these over here? Tertiary. See how there's still little pieces of cartilage there on the tertiary? What about when I get to the terminal bronchioles? How much cartilage do I have? None. Difference between bronchi and bronchioles? No cartilage on the bronchioles and lots of muscle. And it's the autonomic nervous system that's going to control. We call that, whenever the smooth muscle contracts, we call that bronchoconstriction. Whenever it relaxes, bronchodilation. In an asthma patient, which one happens? Bronchoconstriction. There are allergens or something in there, something that's triggered that cause that bronchoconstriction. They feel literally like they're can't breathe. All right, and then we saw here the diaphragm. So what about, here's where the heart goes. So notice that the trachea is behind the heart. What is also behind the heart? Esophagus. What is this tube right there?
Esophagus.
Esophagus. Is this one open or closed? Normally it collapses because it doesn't have the cartilage. Is this normally opened or closed? Open, we hope, to get that oxygen in. Okay, guys, I want to think that that's it. Can we